Okay, so today I want to talk about piercings, especially piercings for children. I've mentioned before I have a 20-month-old, a little girl, and her dad and I have been kicking around the idea of getting her ears pierced because she's a very, very feminine child, and we thought that was something that she would like. She likes playing with makeup brushes. She has all this little plastic jewelry that she's always putting on. She demands to get her nails done at least once a week, her toenails. As soon as it starts chipping, she's like grabbing a bottle of nail polish and pointing at her toes, telling me I need to get on top of that. She's very, very particular and very, very feminine. So we've really thought about getting her ears pierced. So we went to the jewelry store this weekend and, to ask about how much it would cost and everything and, their suggestions because she is so young. And she, as soon as we walked in, she was like a baby monkey on a tree. She grabbed a hold of her dad and she was not letting go. So I was like, oh, okay, this probably isn't the best plan right now. She's really scared and I don't want to traumatize her just to give her something pretty. So I've been wanting to get my ears double pierced, get the second hole put in for a while. So I went ahead and did that. See, look, it's, yay, second hole. And I haven't thought about, what it was like to get my ears pierced since I got my ears pierced. My first hole's been there since I was 11. And I've had, multiple piercings. I had my tongue pierced. I've obviously got my nose pierced. This is actually the second time I had to have it done, and I'll tell you about that in a second. But when I got my tongue pierced, they told me, rinse 3 times a day with Listerine, and especially after you eat, and after a couple weeks when it heals up, you can actually take the barbell out and rinse it in Listerine itself to keep it clean so you don't get an infection because your mouth has a lot of germs. Okay, that's not a lot of instruction. That's no big deal. And when I got my nose pierced the first time, it didn't really hurt like when I got my tongue pierced because that lady, obviously, I didn't know at the time, but she had not had a lot of training. No one told me this. I had a friend that worked in the shop and she had to do it 3 times just to get it in. It was horrible. The lady that did my nose, she was a friend of mine, and she's really, really, she's amazing, super quick, got it done in just a second. Her only instructions were don't worry about the inside because that's why you have mucus, it'll keep the inside clean. And on the outside, just don't use a washcloth when you wash your face because the washcloth will get hung up on the stud and you will rip that shit out and throw it down the sink and you'll have to come in and get more jewelry. And I've done it many times and don't do that. So I was like, okay, well, that's not a lot of instruction. And it healed up super quick. It was just no big deal. It just became part of my face. When I got it done the second time, because I forgot to put it in one night, I used to take it out to put my makeup on, forgot to put it back in, and it closed up. I waited almost a year to get it redone just because I never got around to it. But I got it redone, and it hurt a little more because it had to go through the scar tissue. But again, she was like, don't worry about the inside. Don't use washcloth on the outside. You'll rip that shit out. Send it down the sink. Don't do it. Like, okay. And by the way, I do use a washcloth when I wash my face. I just am careful not to snag the ring. And sometimes I take the ring out to wash my face, you know? So it's not that big a deal. When I got my ears pierced this weekend, the list of instructions you have to, for 6 weeks, you cannot take these earrings out at all. You have to rinse 3 times a day with the special ear care solution. You can't touch your ears at all unless you've washed your hands first with antibacterial soap. You have to make sure that the backs of the earrings never actually close on your ear because that can cause an infection. So you have to make sure the back is in a specific notch on the earring, and then once the 6 weeks is up, for 6 months you have to continue to wear earrings, and they specifically post earrings so that the hole doesn't get any smaller because it has to say a specific size. I'm like, oh my God, what a pain in the ass. just not touching my ears is the hardest thing for me. It takes so much concentration for me not to mess with that earring, not to, because it itches. For the first, I don't know how long it's gonna itch. Really, it's only been since Sunday, and today's Thursday. So, but it still itches, and it's driving me crazy, and it takes me so much concentration not to touch it. So I'm glad that she didn't want hers done, or not even that she didn't want it done, but that she looked so scared and that I didn't get it done and that I got mine done, because I don't think I'm going to get hers done until she's older, until she's old enough to ask me to please, punch extra holes in her body that she wasn't born with. And I think that anyone with a little girl that's considering getting her ears pierced, if you didn't get it done when they were little, because I have friends that got their daughter's ears pierced when they were 3 months old, if you didn't get it done then, and you have a toddler and you think it's a good idea to get their ears pierced, I think you should probably go and get your ears pierced. And even if you've already got them pierced, a second haul, I really think that you should go through that and remember what a complete pain in the ass it is before you try to get your child to deal with this. Because it would be an all-day thing to keep their hands off their ears. And I don't know. That's pretty much my 2 cents on that. I don't really have a lot to say other than that, but I just think, if you're going to do it, you should know you should remember exactly what it's like. So, anyway, thanks for watching. Subscribe to my channel. There's going to be a lot more videos. I know this video is kind of short, but I have a lot more stuff on my mind, so there's probably going to be at least one more video today, and then who knows. So thanks, have a good day, and see you soon.